My name is Ellie Solomon, and I just want to start by thanking Tova for reaching out to Yesh Tikva and inviting us to participate in this very important program. For those of you who don't know, Yesh Tikva is an online community of Jewish women and men who are going through or went through infertility treatments. It came about because of one woman's desire to take a break from her failing pregnancy attempts and create something positive, a positive space where couples of the same religious backgrounds could anonymously gain support and strength from one another. There's a stigma out there that infertility means that there's something flawed in the couple, that there's something to be ashamed of, especially in the Jewish community where family is the center of our religion. To illustrate this point, we can look no further than the founders of Yesh Tikva. Out of all of us, I am the go-to person when requests come in to share their stories. None of them are ready yet to tell their stories publicly, even though some of them are already mothers and seemingly on the other side. In addition, what I've learned from this conference calls with them is that every journey is different. Every couple is different. There is no clear-cut, flawless formula on how to talk to somebody going through the process, since personalities are so vastly diverse. For example, as everybody has said before me, I'm sure you've heard of the segula of carrying in a baby boy at his breast and being with father. Well, when I was struggling to have kids, I was front and center begging my friends to be the father. However, I found out in subsequent conversations with various women that some would be insulted, that they would be ashamed, they didn't want people to know, they didn't want people to look at them, they didn't want anyone assuming that there was something chas v'shalom wrong with them. Infertility is a tricky and sensitive topic, even though you try to simply want to show others that you care. So I'm not able to give you all the answers on how to help your daughters, your friends, your sisters through this process, but rather my goal is to try and help you understand through my personal journey what I went through the various assisted reproductive technologies. I've been called brave and strong for being able to get up in a forum like this to describe my path to parenthood, because many couples feel ashamed and inevitably alone. But I hope that in sharing my story, those people can feel they aren't alone, and couples with children, grandparents, and even singles can understand a modicum of the pain and pressure of trying to have a child in our community. Maybe after this you can gain a sensitivity to those suffering in silence when they're unknowingly seated next to you at Shabbos tables admiring your family photos, or sitting next to you in shul with tears in their eyes during Kol HaNa'arim, or even hearing mazel tovs on births and notice your glances at their flat bellies, or even when they walk down the street and they see someone pushing a stroller. Most people really don't appreciate what a husband and wife goes through when there's a problem getting pregnant. Many people just assume, oh, it can be fixed with IVF. But there's so much more, and I tackled a number of these hurdles, so I hope after this your awareness and your sensitivity will grow. When I first got married almost 8 years ago, at the old age of 31, I assumed that since it took me so long to find my husband, that Hashem would have Rahmanas on me and we would get pregnant fairly quickly after we started trying. Unfortunately, that was not the case. Almost immediately, I went to search out the best doctors to see if there was a problem with me or even my husband. At the time, we were living on the Upper West Side, and I went for my consult at Cornell. My husband and I went through a battery of tests, including some painful procedures. But after that, it seemed that things were generally good with us. Good news, right? Well, when you're diagnosed with unexplained infertility, they kind of try different protocols and see what works. It's the one time where when you don't get answers, when you say everything is fine, that is the worst, I felt. Step one for me was something called the IUI, the intrauterine insemination. I would be required to come in on day 3 of my cycle, get an ultrasound of my ovaries, and take some blood work. And if all was okay, I could start injecting myself with 2 shots at night and then come in at 5 a.m. for blood and ultrasound to see how my body was responding. You do this for about 10 to 12 days. Sounds difficult, right? People ask me all the time how I dealt with all the injections. Well, when you and your husband want a family so badly, all this seems like nothing as long as the end result works. So I patiently waited for my next cycle to come, and we did exactly what we were told. Every night, my husband would inject me with a needle. I'm a very strong woman who could have physically done this myself, but I wanted my husband to feel a part of the process, and this is the way that we did it together. Every other morning at 5 a.m., I would go to the office to be one of the first of about 100 women, or more, likely more, who would come in for daily monitoring so that I could make it to work on time without anyone being the wiser of my quest. Once the eggs were the right size, I would have to take a shot at a very specific time to trigger ovulation and be back in the doctor's office exactly 12 hours later for the IUI. You had to be medactic in your timing and dosages throughout the process in order for it to work. One false move and your entire cycle could be abandoned. I even remember a time we were meeting friends in the city for dinner, and I set an alarm on my phone, and I had a shot in my bag with a cooler, and my alarm went off. I excused myself, I went to the bathroom, I injected myself in the bathroom, and then I went back to dinner. Our first IUI was nerve-wracking. I pinned all my hopes on it working, since there really was nothing wrong with us. And the IUI enabled the male sample to be inserted exactly where the eggs dropped, so they didn't even have to swim very far. The doctor came in to do the procedure, and he was wearing a kippah. For me, I was like, great, it's the perfect shaliach, it's gonna be a miracle, it's gonna work. All the stars were aligned. He did the procedure, I said Tehillim while he was doing that, and then I had to do the hardest thing possible, wait for 2 weeks. The dreaded 2-week wait of trying to distract yourself from what if I don't get pregnant? I feel a twinge, is that my period, is that the embryo implanting? It's a terrifying 2 weeks when you have nothing to do but think. After the 2 weeks, I came in for blood work at 5 a.m. and I had to wait until 2 p.m. to hear from the nurse. I'm sorry, Ellie, it didn't work this time. I didn't understand. I did everything right. Why didn't it work? The doctor explained, just like Batsheva did, that they usually try an IUI 3 times, and if it doesn't work, then they move on to IVF. Great, it usually takes 3 times, so it'll happen in one of the next 2 times. That's what I rationalized. I didn't even think about IVF because I knew that this would work. So a couple of days later, I went to the mikveh. Now the Gemara talks about the mikveh waters signifying a rebirth from a state of tumah. The impurity of a woman's nida is actually referred to as a whisper of death. Now I understand why. When I sat in the mikveh prep room, I realized every month that I had to go to the mikveh, it was because my body didn't give life. It was a whisper, a small shot that it could have happened, but it didn't. My body had failed me in the past. Would this month be different? I sat in the prep room getting my mind set to have my own moment with Hashem, to say, I guess you have a plan for me, and I trust in you, but please help me now. I tried this process twice more, and on the 3rd try, I got the call. You're pregnant. Come back in 2 days so we can check your numbers again. They're supposed to double every 48 hours, like the splitting. So I was thrilled. I called my husband, I got excited, it was right around my birthday, it's a perfect gift. So I came back 2 days later, my numbers doubled. 2 days more, I get a call from the nurse. I'm sorry, Ellie, but your numbers didn't double like we liked. It may be a miscarriage. Come again tomorrow. Turned out it was a miscarriage. It was a miscarriage that didn't clear itself through my body, so I had to take a powerful shot that would force me to wait another 3 months before I could even try again. I asked the doctor, okay, so we're moving on to IVF, right? I just wanted to put this behind me and move on. It was my way of coping. But he said, no, it worked. You did get pregnant. It just didn't stick. So let's try an IUI again and we'll see. Since we didn't need to see the doctor for 3 months and we had all this free time on our hands, my husband and I decided we needed a vacation. So we went to Israel. As luck would have it, I would have to go to the mikveh while we were in Eilat. Now, the Eilat mikveh had a non-religious female taxi driver who, out of the goodness of her own heart, took women from hotels to the mikveh. It was a very interesting car ride. Now, when you get to the mikveh, this was the grossest mikveh I have ever seen. The towels were scratchy. You had to pay extra for a towel. I didn't know I should bring one myself. The place was dirty, but the mikveh woman and the taxi driver were angels from heaven. As I was about to immerse, I told the mikveh woman about trying to get pregnant and my recent miscarriage. She gave me a bracha that still brings me to tears. It was and is still the most meaningful mikveh experience I've ever had. And when we got back to New York, I had my IUI, and 9 months later, my son Jack, Yosef Yaakov, named for my grandfather and my uncle, was born via C-section. After the C-section, like literally an hour after C-section, I asked my doctor how long I had to wait before trying again. He said, with my issues, he would suggest waiting 6 months to heal and then try for 3 months on my own, since maybe my body now knew how to get pregnant and we wouldn't need help. So when Jack was 6 months, we started trying on our own, but my body just didn't get it. By now I was living in New Jersey, so I wouldn't be able to take the train to be in the city at 5 a.m., and I needed to find a more local facility. At the suggestion of my OBGYN, I switched to a New Jersey practice and was placed with a random doctor. While reading her bio, I saw that she was Indian, and that freaked me out because I was used to Jewish doctors. But she had trained at Cornell while I was there getting pregnant with Jack, so that was perfect. Our first meeting, we went over all my old records, and we became true partners in this process. We would go back to doing IUIs. I would wake up at 5:45, it was later because I was living in the suburbs, leave my quiet street to get my blood and ultrasound done, turn around, go home, say goodbye to my husband as he went off to work, and spend the day with Jack. Now, before having kids, I worked as a TV producer for Martha Stewart. And as I'm sure you can imagine, you need all your ducks in a row when you're going over a script with her. So I was trained to be an extremely diligent researcher. I leave no stone unturned. During my son's naps, I read every book on infertility, whether it be Eastern or Western medicine, and I would call my doctor and ask, what about this, what about that? I apologize for being the most annoying patient, but she appreciated the questions to challenge and change my protocols. In being my own advocate and failing at 2 more IUIs, I pushed her to do a blood test based on something I had read, and in fact, it turned out I had an insulin resistance. And insulin affects estrogen, which affects egg quality. So in addition to doing my regular shots, I was now taking some other medications. I got pregnant, but lost the baby shortly after. We were about to try our 3rd IUI when one of my father's friends, who's also an OB, said to my dad, "Isn't your grandson a C-section baby? Maybe your daughter should have her tubes checked again to make sure there was no scarring from her surgery." Thank God I have a big mouth and I allow my father to talk openly with whoever he wants about my process. Because as a result of that conversation, I had that procedure done again, and I'm in the 1% of people that it was extremely painful for. But the second time was less painful than the first one. Threw up during the first one. But they did find that one of my tubes was blocked, which means an IUI really wouldn't work for me, and IVF was the best way around the one working tube. To allay my fears about IVF, because those 3 letters just scared me so much, my doctor told me that IVF, they give you the exact same shots that I had taken with IUI, just with bigger doses. Everything is the same, except when the eggs looked big enough, they would put me under anesthesia and physically remove each egg that was growing. They then fertilized each egg with my husband's sperm. There was another question they wanted to know. For a mere $7,000, did I want to have the embryos genetically tested? I was about 34 by now, trying to pay my mortgage, my insurance premium, $5,000 out of pocket for medication that went beyond what my insurance covered. And being frugally minded, I said, no, I'm still young, let's save the money. Let's just go ahead with a regular IVF. On the day of my egg retrieval, they were able to get 32 eggs, 18 of them fertilized. And now I had to wait those 5 days for the embryos to split. On the 5th day, they would put 2 in me. Great, I'm sure out of the 18, I could get 2. On day 5, I only had 5. I was really disappointed that so few made it, but I guess 5 is better than none. They put 2 in and froze the rest for another time. I only had to wait 7 days for this pregnancy blood work, and then they called. Congratulations, you're pregnant. Wow, IVF is amazing, it worked on the first try. So I came in 2 days later to see my blood work, and it doubled. And I got to the point where they do the ultrasound to see if the sac is there, and there was nothing there. So it was another miscarriage. I asked my doctor, what happened? She said, maybe they were abnormal, maybe your uterine lining is infected. I want to do a biopsy on your uterine lining to see what's going on there. Great, I like answers. So another procedure, just a biopsy, and my lining was infected. And I went on antibiotics, and 2 weeks later, they did another biopsy, and it was still infected. So I had a procedure to get rid of the infected area, and then we would do something called a frozen embryo transfer. We would take 3 of the ones that we froze and put them in. Still shots and blood work and monitoring, but no anesthesia. And when they transferred the embryos, it would be like an IUI that I was used to. I knew that deal. Great. My transfer was scheduled for the morning of Erev Yom Kippur. And I took this as a sign. It had to work. And it did. My husband and I decided that we didn't care about the blood numbers doubling. We would only get excited when we saw a heartbeat. We needed to learn how to manage our expectations because we couldn't go through any more disappointment. So the day they were to look at the sac, they saw 2. I called my husband and he said, sometimes they don't both stick around. Calm down, wait for the heartbeats, let's not get excited yet. So at 8 weeks, we saw 2 heartbeats. Oh my God, Hashem's amazing. I was so excited to go back at week 9 and then week 10, but at week 10 there was only 1 heartbeat. And at week 11, there was none. I didn't understand. How could Hashem give me twins, show me their heartbeats, get me excited, and then take them away? Going to the mikveh after that was really tough. It was more than a whisper of death, it was like a punch to the gut. I wanted to tell the mikveh lady so she could give me a bracha, but I just couldn't get the words out. I was so depressed. They did a DNC to see if they could find out if anything was wrong with the babies. That Friday night, I cried over my candles. I just didn't understand. Monday, I got the call that both babies each had a different genetic abnormality, and it was a bracha that I lost them this early in the game. Now I understood. Every Friday night at candles, I davened for healthy babies. Hashem had listened, and he had a plan. At this point, I said to my husband, I can't do this again. We need to find the $7,000, genetically test the embryos before they get transferred, so I'm not going through this roller coaster of emotions. We also decided we absolutely did not want to know the gender of the embryos, since I personally needed a level of detachment in case I had lost another pregnancy. You see, they accidentally told me that the twins I had lost were a set of boys. And to this day, it's the hardest miscarriage to get over because I always think of the boys. So the money we needed to find was not to choose a gender, but rather to ensure the best successes for implantation and survival. So we sat down for my parents and we asked for a loan. My cycle didn't start for 2 months because of the miscarriage, so I needed something to occupy my time. I researched what increases fertility chances for success, and I did it all. I joined an online support community, which was an amazing space to ask questions from people who had been going through it for a while, and also newbies to go through the process. We understood each other's fears, and no question was a stupid one. We could be our unfiltered selves in this private space, and no one questioned, why don't you have kids yet? Do you want a boy or girl? Are the kids natural? And other seemingly harmless questions that are like daggers to the heart of couples trying to conceive and keeping their infertility badge hidden from view. I also went to acupuncture. I changed my diet with a nutritionist. I got every test taken from my blood to make sure I was clean and healthy. I wanted everything to be perfect. So it was 6 months after my first retrieval with the 32 eggs, and I was ready. But I only got 11 eggs. 11 were mature, and only 5 fertilized. In just 6 months, my fertility had diminished so, and I was scared. Would I get one normal from this small batch? Yes, 1. So I went for another retrieval the next month, and this time, 2 normals. I wanted to do another retrieval so that I could have 4 in total. My doctor said, Ellie, it's time, we need to put something back in, you're getting older. I said, 1 more round, and I read about this other thing that might help embryos make it to day 5. I know it's expensive, it was $2,000 for 5 days worth of shots, but let's go all in, and I promise, I only need 1 more. So if I have 4 normals in total, then we can put back in. So we did 1 more round with this other medicine I had read about, my acupuncture, my online support group cheering me on, and I was feeling great. It was unbelievable. I had 11 embryos make it to day 5, and 9 of them were normal. So they quickly put 2 back in, and we waited. I was pregnant. 1 baby had dug its way in and stuck around. We had even graduated out of our fertility office to a regular OB. When I took my prenatal blood work, I got a call from the doctor. So, it seems you have CMV, cytomegalovirus. It's a virus that isn't a problem unless you've never been exposed to it before pregnancy. But since you have that twin miscarriage, you took that blood panel, it showed that you've never been exposed before. We've never seen such a clear-cut case of someone who contracted CMV for the first time while they're pregnant. So it was a good thing you got tested after that miscarriage, but unfortunately there's some risk with the pregnancy. The baby could be born blind, deaf, mentally retarded, or stillborn. My first reaction was, are you kidding me? But after a couple of days I could rationalize it. Maybe this is why Hashem gave me the miscarriage before, so that we could find out that I had never had the virus and we could treat it now for this baby. When it came to me dealing with infertility, I had to be practical, scientific, not emotional, but that's me. So I traveled to New York, I came here to CHOP, I consulted with doctors in Florida and Italy, and we came up with this solution of me sitting for 6 hours in the hospital every month, taking medication that would hopefully pass through the placenta and help my baby. They put me in the chemo unit the first time, and they said, what kind of cancer do you have? I said, I don't have cancer. I have a virus and I'm pregnant. From that point on, they did not put me in the chemo unit. We would only know at 26 weeks if the baby was healthy by having an amnio. I was really scared. People would see me around town and see my expanding belly and ask if I was expecting. Side note, never ask, ever. With tears in my eyes, I didn't want to lie. I said yes, but, and I explained what was going on. With the tefillos of the women in my community, And the help of Hashem, the baby did not get the virus, and he was born via C-section, and it was perfect. Gavriel Asher. Because without Hashem's strength, we would not have been able to make it. I wasn't done yet. Again, I asked my doctor, right after the C-section, how long I had to wait before trying again. He said, for you, 6 months. So at 7 months, I went back. I had the procedure to get a fresh lining like I had learned before, and took a different shot to make sure my body would not make any eggs since we were doing a frozen embryo transfer. My doctor asked if I preferred to put in a specific gender, since they knew what they were based on the genetic testing. But I said, are they all the same quality? She said no. I said, then put the 2 best in and don't tell me. And I waited. The blood test came back pregnant. The numbers doubled. The ultrasound showed 2 sacs, but I had been here before. There were 2 heartbeats, but I had been there before. And at about 20-week anatomy scan, it really hit me. Oh my God, I'm gonna have twins. As I was sitting in the hospital getting ready for my scan, I had to fill out some paperwork. One of the questions hit me like a ton of bricks. How many times have you been pregnant? I put down 6. How many live births have you had? 2. How many other women have to relive these miscarriages every time they fill out a medical form? Because of the bracha of being pregnant with twins this time, I decided to do something to help others, and I decided to start a fertility group in my town. I put up signs in the mikveh, told the local Tehillim group for women davening to have babies about it, and unfortunately, but fortunately, 6 women responded. None of them wanted to meet in a group setting. They just wanted to talk on the phone. I didn't care, as long as they had somebody to talk to. Our husbands are our partners, but sometimes they don't get it since it's not their physical body that's going through it. In speaking to others, we can learn so much, and sometimes we can save time, and we can feel secure. I learned from this desire of secrecy that there are so many that it's so important for in this silent sisterhood. Thank God, 2 weeks before Pesach, my newest miracles arrived. Adela, whose Hebrew name is Fega Fruma. She was our only girl, so we had to put all the grandparents' names in there. And Nady, who is Yonatan Simcha. She was named for my grandmother and my husband's grandmother, Fega, and my husband's Savta Fruma. And Yonatan Simcha, well, Hashem really gave us happiness. It's an emotional roller coaster. It's an extremely expensive proposition, even with insurance. Parents worry about paying yeshiva tuition, but you should know that Gabriel alone cost me 3 years of expensive New York yeshiva tuition out of pocket before he was even born, and we had insurance. It's a long and intricate process, all of which needs financial and emotional support. Once again, I thank you for giving me the forum to inform those who may not know and may not have realized the ins and outs and the different avenues one can go through to achieve a family. I hope that we can be better friends and sources of comfort to those who outwardly and secretly need it. Yesh Tikva's website provides a Jewish fertility community for those who want to ask questions, join forums, and get support anonymously. We also have a new program called Fertility Friends, where a social worker pairs you up with either a fertility veteran like myself or someone traveling the journey at the exact same time that you are, so you have a buddy to go through the process step by step. There's a lot of information on what to expect in the process and blogs of various couple stories. Please feel free to check it out and tell those who you think may benefit. The more we know, the better patients we can be, and there is no best advocate for your own care than you. Thank you so much.